Hey everyone, and welcome to the Health Coach Tip Tuesday show, where every week we are going to share tips, tools, and resources for health coaches and professionals so you can confidently solve your clients' health issues and grow your career as a health coach or professional. If you are ready to dig in right now, drop the word symptoms in the chat, and we are going to send you a link for today's webinar that is called How to Be a Health Detective, and that starts at 3 p.m. Pacific, 6 Eastern. We're also going to send you a link for the brain body diagram video. I am Piper Gibson, your co-host and course counselor, and the man next to me is Reed Davis, the founder of Functional Diagnostic Nutrition. He is going to share his expertise and wisdom with us today. So hi, Reed, how are you?
Doing fantastic, thank you.
Awesome.
Glad to be here.
I'm glad to have you every week to share all the great information about FDN and how we can all be better health coaches. This week, Reed is going to teach us about why symptoms don't tell you what's really wrong with a person. So if you are ready, make sure to drop the word symptoms below. We're going to send you a couple of links, but Reed is going to teach us all about why symptoms don't really tell you what's wrong, and he's going to give us an awesome presentation today. So take it away, Reed.
Hey, thank you. This is actually not an in-depth discussion of why symptoms don't matter, but it's a quick demonstration that you can use anytime you want to orientate your client. And I used to do this in front of patients in the office, like one-on-one. I would have a patient, or maybe a patient and their spouse sitting there in front of me. I would just kind of use this to demonstrate, here's how we work. I also did this in front of large audiences when I was out recruiting new patients or clients for the clinic and for my practice. So I did this all over the place. I've done it on whiteboard. I've done it on a blackboard. I've done it in webinars. I've done it on a flip chart, and I've done it on a napkin, just trying to explain it to the person at lunchtime and that kind of thing. So it's really a neat, very usable tool. So I think also you're going to give a recording of me doing this at some other format or presentation. So that's going to be a really neat gift for you. So what I used to do is joke around with my clients, say, hey, what's that big organ up in your skull that allows you to think called? And they would say usually correctly, brain. So tell me if this is coming out good. I'm going to write a circle up here and put brain in there. Can you see that okay? Is that coming through pretty well?
We can see it. It's a little small, but we'll make do, and everyone will get a recording of the brain body diagram, so it'll be perfect.
Okay. All right, I'll try to write bigger. So that's his brain. And the brain is connected to the body through various mechanisms. You have your blood, the blood carries hormones, it carries immune transmitters, things like that. Also, of course, the nerves are critical because they carry messages all over to every cell in your body. Actually, you also have chi, energy and flow and different types of things like that. So the brain's connected to the body. For what purpose? Well, we're just going to put a big circle in here and say function. I don't need spell check for that one.
No, it's perfect.
So we have function. A function of what? Your pancreas, your adrenals, your ovaries, your testes, if you got them. You name the organ, system, cell, tissue, whatever it is. The brain is connected to the body for the purpose of function. All these messages being transferred and transmitted around. And what we think we're pretty sure about, I'm pretty sure about it, is that you're designed for 100% function. Hope you can see that 100% there. And that's what I would call normal. So again, maybe the camera and the setup here could all be better, but you get the point. Are we designed for 100% normal function? Is that pretty much, do you have to teach any cells what their job is, Piper?
No, not at all. Absolutely. No. We are supposed to be balanced.
Amen. So now, what's the purpose of all that? Well, what you want is a body in a state of ease. Now, you can go to any Eastern guru or any, any kind of, alternative practitioner, natural practitioner, integrative practitioner, functional medicine practitioner, and you should pretty much hear something similar to that when you talk about health. If your brain and body are connected and you're functioning normally in a state of ease, would you be healthy, Piper?
Yeah, you would be healthy and you would feel good.
Is that how people come to you in your office when you're seeing them
Absolutely.
as possible?
Absolutely not.
So
That
what
is
do
not
they
how it
have?
goes. They have
So
dis-ease.
they have, well, what they have, first of all, they don't come in there and say, "Hey, I've got disease." They
That's true.
come in and say, I have these. And that was the word for today, symptoms. So they come in complaining of something. I'm tired, I'm fatigued, I have allergies, moodiness, other sensitivities, pain in my neck, pain in my butt, whatever it is. They come in with some kind of a sign or symptom. There is something about the way they look or the way they feel that they want to change. Otherwise, they wouldn't be in your office. They don't come in and say, "I'm perfectly healthy. I just want to talk to you." So you get the point. Now, we just said the body was functioning normally. Normally is really good in a state of ease. How could they possibly have symptoms? Well, the truth is there must be some form, I hope you can see this, of disease. Now, I'm not sure if that's where the word disease comes from, but it makes a lot of sense to call lack of ease or dis-ease. Is the body functioning normally anymore? No. There's something that's not normal. There's some cell, tissue, organ, or system that's not 100%. We would simply call that malfunction. Malfunction. So malfunction, disease, then symptoms show up. What's really, really important here is to understand that symptoms are the last thing to occur in what I'm sure you've heard called a dis-ease process. And so people come in for what? The first thing they want, I'm not going to write it down. Some of my bigger presentations, when everybody can see good, I would write down relief. People come in for relief on the symptoms. They want to, whatever that is about the way they feel, they want to get rid of it. If it's the way they look, still they're willing to cover it up, patch or something like that initially. So we call that relief care. How long does that last? I mean, have you done if you did get the symptoms down here to go away, would that change the disease process or the malfunction? Would it improve the cells in any way?
It wouldn't.
Incredibly
You're
rarely,
putting a
right?
Band-Aid on it. Right. You're putting a Band-Aid on those symptoms.
Yeah, and that's not all bad. I mean, if I have some real severe achy, painy, owie thing going on, I'm going to, probably take something or do something to, like a massage or, whatever it is, take some extra supplement, but that's not long-term how we're supposed to work as health coaches. Matter of fact, that's where medical doctors are the best. Man, they can give you something, that symptom's gone, and it could be gone for a long time too, if you're willing to take that stuff. We know drugs are poison and, they have their benefits, but they have their downsides. So most people coming to us, yes, they understand the relief. They've been chasing that for a long time. They might be sort of caught in this cycle of trial and error. We talk about trying this and trying that and trying this and trying that. They get a little relief, but it never really goes away. So in our world, we look at what does it take to correct the malfunction and reverse the disease process. So we now know that symptoms are the last thing to occur in a disease process. They may disappear with relief care, but if you don't handle the disease and malfunction, they will either come back, sometimes with a vengeance, or guess what else happens? New symptoms appear. The something else starts leaking somewhere else, so to speak. So the idea is to stop chasing the symptoms. Relief care, again, I'll put it out here. Relief care is not all bad. What we prefer is what we would call corrective care. Correction. Okay, correction. Spell check. So correction is what we're after. And that's exactly what we do in FDN world. We would look and run our labs for the healing opportunities that exists. Again, we're not trying to diagnose. People had enough diagnoses, medical diagnoses. We don't diagnose any medical condition. We do run diagnostics of sorts because we look at the hormones, the immune system, digestion, detoxification, energy production, nervous system balance, the autonomic balance that you have to have. And when we find we work at that level, when we correct and return the body back to normal function, back to the 100%, the disease goes away and the symptoms disappear. Automatically, you are doing correction. And then the last phase, of course, the last type of care, if you will, we call it maintenance. So in our world, as you well know, Piper, as being a very experienced and knowledgeable FDN practitioner, we don't look at the symptoms as the problem. We look at how the problem's showing up. The real problem is the disease process, the malfunction or loss of normal function somewhere in the body. So quiz time. Are symptoms normal?
No, symptoms are not normal.
That's right. And yet, what you've heard over and over again, pardon me, is that it's normal. Like I've had a lot of clients say, well, I went to my doctor and he said all my blood work was normal. And that it's normal because I'm older, because I'm a woman, or because I, work in a hair salon or something, that my symptoms are normal. I once had a client of mine say that when she went to her doctor for some pain she was having in her lower abdominal region, and he told her, that's pretty normal. What I want you to do is take this medication for a couple months, and if it doesn't work and if it doesn't relieve your symptoms, we'll do a hysterectomy. To quote, it's perfectly normal for a woman your age. Tell me a hysterectomy is normal.
Absolutely
That's
not.
the ultimate relief care. Pull the symptoms out, pull the organs out. And so, I have lots of jokes about that, but, let's just see if that's working for people. If that worked, say cool or something.
Well, talk a little bit about how symptoms are so far removed from what's actually going on in the body.
Okay, sure. Well, we have this idea that, where's my pen here? So again, I talked about how does this communication work in the body. We have the blood, things floating around there. We have the nerves. You can get pressure on nerves from physical trauma and things like that. And we have chi, which is energy, which I'm not going to begin to explain here, except to say that it's an important consideration. How you feel about things, energetic flow in the body. Where I've tend to specialize, as a matter of fact, is not so much in the, let's say, the types of trauma. The things that would affect communication here would be, let's say, mental, emotional stress. That certainly is one type. There's trauma, like built up from accidents or bad posture. And then, or weakness and imbalances in the musculoskeletal physical body. And then you also have, of course, the chemical, or what we might call biochemical, because some of these things are going on inside your body. And so we have these different types of stressors: mental, emotional, trauma, chemical, and biochemical stressors. They're what are causing the malfunction. And so we have, I was trying to explain this, our labs. We look at the blood, saliva, urine, stool, whatever it takes. We do an assessment, and then we base a protocol to return the body to normal function that way. And of course, that's where our Dress for Health Success system comes in.
Fantastic. A lot of people will come to see me and somebody will say, oh, I have a headache. And then I explain, you may have a headache for one reason, but I may have a headache for another reason, because the symptoms don't always stem from where the actual dysfunction or dis-ease in the body is going on. So, symptoms absolutely do not tell you what's wrong with a person.
Yeah, that's a really good point. And I see where you're going with that. So let's take thyroid. It's one of my favorite symptoms. People who have, let's say they're tired, fatigued, They have a few extra pounds they just can't get rid of. Their hair might be thinning. They usually have cold or even numb extremities. Especially maybe the hands and feet. Constipation is huge. And so that's a typically reliable cluster of symptoms that points the finger at thyroid.
Mm-hmm.
And so the thyroid is part of the endocrine system. Well, that can be getting a lot of influence from all these other systems in the body, whether it be the nervous system or, how you break down carbohydrates and digest them, or the musculoskeletal system, or, all kinds of other systems. There are thousands of functions in the body, metabolic processes. That's where our term metabolic chaos comes from. So from various influences in the environment, including how you live, how you eat, how you rest, how you exercise, the types and various types of stress, as just went over, mental, emotional, trauma, and physical stress, or the chemical, biochemical stressors of the planet, and things like that. They're bombarding us, and we're each individually prepared to deal with that bombardment. We have weak links in metabolism. They're very unique to each individual. So based on the way metabolic chaos works, is it cascades. All these various stressors come in one way or another, and they cascade around the body. And through various weak links in metabolism, they'll erupt, if you want, manifest as symptoms. And Janelle, you're perfectly right. Everyone has different weak spots where symptoms may manifest, and how they get there can depend on the individual too. And so that's really, really a critical way of thinking about the body. That's why we don't chase symptoms, because we don't know exactly where they came from. Sometimes like if you eat a certain food and you get a rash, well, your body's reacting to that food in a abnormal way. It could be an inborn error in metabolism, just the way you were born. It could be something that was acquired, but that's pretty simple to figure out. That's a symptom that you pretty much know. But what about people who have rashes and they don't test positive for any kind of allergy? They don't have any idea where it came from. So you have two people. One, it's an easy fix. The other one could take you 10 years to figure out, or you may never figure it out. And that type of stress will cascade and cascade and cascade. Remember, it's only manifesting as a symptom. Its origination could be several loops back, way upstream, if you want to use that analogy. And that's why we don't chase symptoms any more than we have to for relief care. And you should be able to get rid of any symptom in just, week, 2 weeks, 3 weeks, something like that. There's tricks you play with, avoidance supplements and different things, some sort of fast fixes, but only for the relief care part of a wellness plan. Wellness plan should actually include what I just talked about. Relief care, no problem. You might stay on your medication, whatever you're taking. If your doctor prescribed it and said this will make you feel better, you might want to stay on it. But if you want to get off it, you'll start looking into corrective care. Now, once you've figured it out and got it corrected where you don't need that medication, whatever type of relief care you're using, then you go into maintenance care. And I've always said, and you've heard it, Piper, if you teach a person to fish, you feed them for a lifetime. So our job as health coaches is to help the person figure it out. We do this, the common term now is biohacking. I always just called it straight up health detective work, just investigation, do the lab work, do the intakes, things like that, do the exams, whatever it might take. And then once that assessment's made and you've correlated that with your client or yourself, if you're just working on yourself, then you have to bring in a program that's going to address every cell, tissue, organ, and system simultaneously. Since most health coaches are not physicians, we can't write a prescription. That part of relief care is a little tougher sometimes. But what we're really interested in is a correction anyway.
Absolutely. So Reed, do you have one important takeaway or tip you would like to send everybody off with today?
Symptoms are the last thing to occur in a disease process. They're not the problem. They're how the problem shows up in your office. And so you got some education. Again, I did this drawing on maybe a little bit bigger of a whiteboard in the office. This might even be the same easel I had 20 years ago, and just did this for every customer coming in, and got them thinking about what's it going to take to resolve this problem from the functional level rather than just relief care. Because if relief care worked, they wouldn't be in the office. They'd have found their medicine. They'd have found their magic bullet or lotion, potion, powder, or pill, we used to say. And in fairness, that's more than one thing.
That's okay. We get where you're coming from, and it absolutely makes sense, and it's definitely going to help everybody to grow as a health coach or whatever profession that they are in, where they would be using some of these skills that you're teaching. So thank you so much for sharing your wisdom and expertise with us today. If you guys are ready to jump in, make sure to type the word symptoms in the chat, and we are going to send you a link for today's webinar that starts at 3 p.m. Pacific. And we are also going to send you a link to watch the brain body diagram video. You can have it to look at and see so that you can get a really good visual of what is going on. So we will send that to you as well. But thank you all for joining us this week. Thank you again, Reed. And we will.
I just want to add one thing.
Sure.
Practices. Write this out on a piece of paper. Start doing this for your clients. They'll be amazed. You'll be the first one that explain to them how their body works and why they have symptoms and how you work. It's an excellent way to teach people how you work. I learned this from this chiropractor long time, like 20 years ago, David Singer, amazing guy. And this is, he just used it in terms of like nerves. Let's get the pressure off the nerves, and just used it in relationship to the physical trauma. But I adapted it to the whole body, every kind of interference. And so I just wanted to give credit to Dr. Singer and tell you that you can use this practice. I've been using it for 20 years and it's worked like a charm.
Awesome. Yeah, I've used it as well. And I think it's really a good visual for people to look at and really get an idea of how it all breaks down and how it all works. So thank you again, Reed. Don't forget, drop the word symptoms below. We're going to send you a link for the webinar and a link for this video, and we will see you guys again next week. So thank you for joining us. We'll see you later.